Indeed, the state of Texas is one state that has seen a significant spike in the number of people testing positive for COVID-19. If there is a hint of good news, it's the fact that it appears to be plateauing, perhaps reached its worst. And there's one county in the southern part of the state having to make very difficult decisions, Starr County, deciding who lives and who dies. The ICU ward is just simply overburdened. Here at UT Health Tyler, you can see over my shoulder a sign that says heroes work here. They're recognizing the people on the front line. And this hospital is holding its own here in East Texas. And a lot of COVID patients, not just from the city of Tyler where we are, but the surrounding rural counties are brought here if indeed they test positive for COVID-19. But as I mentioned, its ICU ward is not overburdened and they are still doing elective surgeries. About 3 weeks ago, the governor mandated people wear masks in public, but there's been a tremendous pushback here in Texas. A lot of people just don't want to wear them. And we talked to a cardiovascular surgeon earlier, and he talked about why it is so important. And this is a doctor who wears the mask as much as 8 hours at a time during surgery. It's uncomfortable, it's difficult, but it is something that people can use that can make a significant difference.
If you don't wear a mask and you don't social distance, you're at a fairly high risk for picking up a reasonably contagious illness. And statistically you may do fine with it, but there are a fair number of people that are going to be very sick for a protracted period of time, and a lot of people that are going to die from it. There are people that believe there's a political motivation to either believing in the virus or not believing in it, and for a lot of these people it has taken a little more coaxing to get them over their internal biases to realize that there is a real medical illness here. It is a problem.
And people not only have to wear masks in public places and social distance, but here in the hospital at UT Health Tyler, all employees must go online and fill out a little health information before they come in. Then once they get here, along with all visitors and all vendors, they get their temperature taken to make sure that it doesn't spike. 97.1, so I would be allowed to come in. But it's something that people are trying to do, hospitals especially, to make sure they control or at least keep a lid on the situation in Texas. Again, very important to wear masks, keep social distancing, and it's something officials keep hammering away at, trying to get people to in this state. And that could make a huge difference moving forward if this plateau stays and begins to drop, or if there is another spike. Sean Caleb, CGTN in Tyler, Texas.